Hello, and welcome to the Smart Injury Doctors podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors, and welcome to today's program. The topic for today's program is smart injury doctors are aligned with insurance company needs. Now, that may sound a little bit interesting, but I train doctors all over the country, and I also speak with attorney groups, and I've spoken with groups where insurers were present. And the thing that's always baffled me is the fact that the injury market is such an adversarial market. Now, it's an adversarial market because there's so much confusion in the market. But myself, as a trainer of doctors and a trainer of lawyers on ligament injuries, one of the things that I found fascinating is my role in this market is to help doctors to identify really significant injuries to the ligaments early. And you do that early so that you can get great patient outcomes with the patient. Now, in the personal injury market, everybody's looking at the injuries and the resolution process, and that's an interesting process. I have doctors that will come to me in seminars and say, well, how do I make attorneys more money so they refer to me? And I say, well, gosh, your actual job in the market is to reduce insurance benefits. You're more aligned with the insurance carrier than you may believe. And I remember even for myself, I was in the injury market for a time as a young practitioner. And I used to think, geez, these insurance companies are hard to deal with. They're constantly trying to cut my bill, even though my bill is legitimate. They're constantly using independent medical examination and utilization reviews. And then I have to rebut these things. And it was just, it was all kind of traumatic for me at the time because I didn't like the paperwork aspect of it. What I liked was treating patients, diagnosing their condition accurately, and getting great results with them. And one day I had this big aha moment, and the big aha moment was that I was aligned, my purpose and my goals were perfectly aligned with the insurance carrier's purpose and goals. So I'm going to explain that to you really simply. Let's say a patient came into my office and they were in a wheelchair due to a low back injury that they received in a car accident, and they couldn't walk. And they went basically 4 months, 5 months, 6 months worth of care in my clinic. And now they were able to run a 5K run. They had no chronic pain, and they had no activity of daily living that was interfered with at all by their trauma. They could do everything they did prior to the trauma, and they had no disability of any kind. My role was complete, and my role significantly reduced down the future benefit need of the patient. And that's my role as a doctor. That's any doctor that's really good at injury work. That is our role. Our role is to reduce down future benefit needs. That's our job. So our job is not to take an injury and make the patient so that they need care for the rest of their life. That's not our job. Now, patients can need care for the rest of their life. I mean, I am a licensed doctor of chiropractic, and I believe very much in wellness care, elective care that patients choose to actually help maintain their spines. But that's significantly different than what the insurer is responsible for in an injury scenario. In an injury scenario, that insurance carrier, for the most part, for the types of injuries that we deal with, which are the spinal soft tissue injuries, for the most part, yes, patients that don't fully recover may need future care. And that future care can be argued needs to be paid for by the insurance carrier that's at fault, that's insuring the person that caused the injury in the first place. But the bottom line is my job, my role as a really good injury doctor is to reduce the benefit need. It's to reduce the long-term benefit needs. It's to minimize it significantly. If I can minimize it completely, that's my job. That's my role. That's what I teach our smart injury doctors is their role. And we may be one of the only groups in the country that teaches that brings that out to your attention, is that your job as a doctor is to get great patient results. That's what your job, to do it as effectively, as efficiently, and as quick, as cost effectively as you possibly can. If you can do that, especially in the back and neck injuries, and you can minimize the cost significantly, you should be the most sought after doctor in the market. Employers will be searching for you. Insurers eventually should be searching for you. Patients should definitely be searching for you. And attorneys should be searching for you, because your goal as a doctor that actually can accurately diagnose what the patient has and then treat them to a great result in a relatively short. And when I say relatively short, I consider 3 to 6 months to be relatively short. When you take significant ligament injuries, if you can get those to not grow chronic, because remember, according to research, 50% of the patients are going to be chronic. So if you can get them not to be chronic, and you can do that in a relatively short amount of time and in a cost-effective manner, you become one of the most sought-after doctors in the market today. And the thing that's nice about it is that you learn to sleep extremely well, because you realize your purpose and your purpose-driven actually is aligned with everybody in the market. It's aligned with exactly what the patient wants. It's aligned with exactly what the insurer wants. It's aligned actually exactly what the attorneys want. It's aligned with what employers would be looking for. So it's aligned with everybody in the market. And it's when you're aligned with everybody in the market and you're producing a valuable service that everybody in the market wants, it makes it a whole lot easier. Now, I'm going to tell you a funny story. And this is problematic for all of us in the injury market that do really good work, and I'll tell you the story. I was asked to speak with a very large defense firm in Michigan years back. And so I went and spoke on ligament injuries. And it was a fairly interesting, I had only an hour. I gave a very good talk. I thought, okay, why would insurers want somebody who points out objectively patients' injuries? Why would they want me to speak on ligament injuries? These are the most costly injuries that there are. And then I realized, okay, remember, Jeff, your purpose and your goal is very much aligned with what the insurers need. So I don't know, there's 100 people, 150 people in the room. And I started off the talk with the fact that, half of you in the room right now are probably suffering with some form of chronic pain. And the reason why you suffer with it is because you don't have a doctor that knows how to accurately diagnose it, because it's a ligament condition. If you're suffering with any kind of back-related, neck-related problems, you're suffering with a ligament condition that's gone undiagnosed. Now, I gave this talk, and I had a lot of case managers and defense firm people and utilization reviewers come up to me afterwards and say, well, Dr. Kong, how do I find this kind of doctor? And one of the things that was interesting, one of the major carriers came up and said, well, Dr. Kong, how do you explain, I've got 4 months worth of care here, chiropractic care, and I got a $42,000 bill. And I said, well, okay, I don't know. That sounds excessive to me. I don't know anything about the specifics about it, but you have all your fraud procedures. You have all your internal procedures that you can use to reduce that. Let me follow up and ask you a question. Why do you treat the good doctors exactly the way that you treat the bad doctors? So in other words, I asked a preliminary question, are there good doctors? And she said, yes. And I said, well, then why do the insurance carriers treat all doctors the same, as if they're all bad? You have to reward the actual, if you want a particular activity to occur, you have to reward it when it is occurring. You have to reward the behavior that you want. So doctors in this new injury market, when I talk about the new injury market should be a market about innovation. It should be about getting great results with patients right away and not being so inefficient in the market. The medical / chiropractic / osteopathic / physical therapy market needs to become a much more efficient market. It needs to get a lot better results very quickly with these neck and back injuries. But what I wanted to talk about today is the fact that if you're a good injury doctor, you really take a look at it. If you get great results in a short amount of time, you are very much so aligned with the insurance carrier. So why are you adversarial with them? Now, I realize they do things that are kind of different, and they can do things that are adversarial, and they can outright attack good doctors. I understand that. But if you're doing the right things, and even if you're attacked, you can withstand the attack if you're doing things the right way. So just take a look. It changed me when I started to realize that the insurance carriers themselves were not the enemy. It changed me in a huge way. And take a look today when you're sitting there and you're thinking about what I said on today's program. Just think about the fact that, again, if I take this person, he's in a wheelchair, 6 months later he's running a 10K run and he has no problems, I've seriously minimized his long-term insurance benefit needs. And that's my job as a doctor. That's your job as a doctor. And again, that's what I teach in our Smart Injury Doctors program. Doctors, every single time I do a podcast like this, I just take a short topic and I talk about it. Hopefully it makes you think about the topic maybe a little differently than the way you have before. And hopefully that leads to a little less stress and a little more understanding. Doctors, before I end today, if there's a comment that you want to make on this program, please do. I look at them. They are how I start to structure what I want to talk about, because what I want to talk about is what you want me to talk about. I want to talk about what are the problems that you're facing in the market. If you would put them down below, put the 2 biggest problems that you're facing in the personal injury market or that you would like to see go away. I look at these comments and I actually do future shows based on those comments. These shows are meant to be 8 to 12, 13 minutes long, give you something to think about. And doctors, I thank you very much for your time today. I look forward to you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.